Hello everyone, I'm Jim Longworth and welcome to another edition of Triad Today, coming to you once again from the Kernersville Auto Museum. It's a great place. We'll tell you more about that later on. And later on, so when the roundtable shows up, we'll get into all sorts of controversial topics with them. Some great guests, important information coming your way in the half hour, so stick with us. Where we want to start is I get to talk with two angels, and they are certainly that. And they are working for Mountain Valley Hospice. On my immediate right, Kelly Cale is an RN case manager at Mountain Valley, and Mariah Tyler is an RN after hours. And ladies, thanks for being here.
Thank you.
I'm going to ask both of you to reply to this very quickly. Who or what inspired you to go into nursing? Was it a teacher, an aunt, uncle, mom, dad? So we'll start with you, Mariah.
Actually, my mom. My mom's a nurse.
Oh,
Also,
okay.
my grandmother was a nurse, so it's kind of.
So you got the whole lineage going,
yeah.
grandmother
yeah,
and
I'm
mother.
third generation nurse.
Well, any specialties that they were in? Or?
My mom did neurotrauma. Neurotrauma. My grandmother worked in a nursing facility for many years.
All right. Kelly?
Well, my dad wanted me to be a nurse from the time I was very small. It was he did X-ray technology, and he always wanted me to be a nurse.
How about that?
So I did that.
Now, Kelly, a lot of people don't know that this is when you help people who are in end stages of life or need your help, and I went through this with both my parents. You guys will come in and go to the home and really get to know folks and help them. So Kelly, just very briefly, what's the first thing that people can expect maybe on your first visit when you're helping people?
Well, when we go in, I always sit down and get to know everybody that's in the room. And that's very important so that they know that you are the case manager.
Right.
That you're going to be the one with them through this whole process. And you're going to make them feel comfortable as you possibly can.
Because they're also the caregivers. They got to be part of your team as you're working in there.
Yes.
Yeah.
It's a little hectic at first when we first get a patient because everybody's coming in. But then, you know, you have to set goals and plans and explain the medicines and how hospice works.
Yeah, it's really comforting to know when we get somebody like you to come in and work with us, and the whole family's around there and gets on the same page about caregiving and what each person can do. Mariah, give me an example, or just what do you think is maybe something that people misunderstand about hospice and hospice care?
I think a lot of people misunderstand. They think it's maybe just for the patient, but we're actually there for the families. A big part of what we do is being there as a support system to the families, educating them and empowering them on how to take the best care of their loved ones. So they call us, we come to them, like you were saying, we go to them. They don't have to go to the doctor's office anymore.
Right.
They're just a call away. So.
I'm going to ask both of you to sort of finish up on this, which is, what's gratifying to you about what you do? And I'll start with you, Kelly.
Well, I feel like that two of the most monumental times in your life is a birth and a death. And we all go through that. And I feel like that we as hospice nurses in the whole organization, we have one shot to make this a good experience for our patients and their families.
Yeah.
And because I don't want them worrying, I don't want them being upset. They have enough to worry about. They're grieving as we do this.
Right.
So I think that we have to have empathy, and we have to really put ourselves in their position.
Same thing. What's gratifying to you?
I think the most meaningful part of it is obviously helping them have a peaceful passing, and then just being there for the families. I find a lot of joy in being there for the families during this really difficult time.
And I'll remind folks at home that, not that these ladies asked me to do this, but Mountain Valley Hospice is a nonprofit group, and they do not turn people away who need help. Up on screen, mountainvalleycares.org is a website I'd like for you to visit, Mountain Valley Cares, or you can call 336-789-2922, and I hope you will do that. And to you two angels, and I appreciate what you do. I'm serious. Thanks for everything.
Thank you for having us.
Thank you.
We'll be right back after this.